those were actually run by folks that were based in the schools, and so those were a little bit different. They were, I have to say, they were quite robust compared to the multidisciplinary teams that we have today, just because they had that structure of being a little funded differently. And so I was just giving that as an example of how they've been used in the past that we know was effective, that as we're looking at the multidisciplinary teams today, maybe there's some things that we could learn from that and, again, just improve the efficacy of the current teams.
Okay, thank you.
Okay, thank you, Representative. Okay, thank you for that. And since you're there, our next one is kinship guidelines. This is something that confuses a lot of people, and we do make changes once in a while to it. So tell us what we're doing now.
Perfect. I will give just a high-level overview and leave time for any questions that you may have about the DCFS policy with kinship. So kinship for us is a real priority. We know that research shows that children and youth who are placed with kinship and relatives when they come into custody have better outcomes, that they experience reduced trauma based on that removal, they have increased stability and permanency, and that they've really shown overall improvement of their well-being and sense of self. They have improved behavioral and mental health outcomes, and that they are able to experience really just a preservation of those community connections, a sense of belonging and who they are, and they do tend to have lower rates of attachment disorder. So there are several state and federal laws currently in place that prioritize those efforts to place with kinship, and supporting a child's right to just have as many safe, familiar relationships as possible. So our policies emphasize the need to do an exhaustive search for kinship, and that is happening immediately after removal. We are wanting to ensure that we are reaching out to as many kinship and identifying as many of those relatives as possible. And that's not just up front, but throughout the case. And that's because we know that children cannot have enough caring adults in their lives, that the more people who care about them, the more that they can connect with relatives, the better those long-term outcomes are. We do know that when we are searching for kinship and making those decisions, we understand it can be very challenging for a child who is in a loving foster home, developing a relationship with that foster parent. And then if we are identifying kinship, that assessment is really based on looking at the best interest of the child. And we understand that when the decision's made to transition a child to a kinship family, that can be incredibly difficult. And the good thing is that research does show that these transitions can be done well, and that if the child has established a positive relationship with the foster parent, that actually sets that child up for success in developing and having future strong relationships with other adults in their lives. So, of course, again, just recognizing and acknowledging those challenges created when there's a delay in identification of kinship and transitioning. So we have developed several processes over the past year and initiatives to really assist in locating kinship options as early in the case as possible. And that includes DCFS regions are reporting out to the state administrators and their local region to ensure that those efforts are taking place. DCFS leadership is reporting to the DHHS executive leadership team on those efforts and providing data on improvements in that area. We're really excited about a pilot project that's in Salt Lake Valley region with Raise the Future. They actually have a full-time employee that is searching for kinship, and that enables them to have time to actually do warm outreach, which is personally calling kinship, talking to them about the case, really being able to understand if maybe they're available for placement, or maybe they just want to continue to connect with this relative and be a support to maybe the current placement or the foster placement. And we also have what we've created in the past few years, which is a new initiative, which is the Family Action Meeting. And those are really bringing the family together as soon as possible, as soon as we're identifying a safety issue in the home, bringing relatives, family, all of those supports together as early as possible so that we can plan for safety, and get all of those supports in place to really support the child and the parents. And again, it's just important that connecting children, not just for placement, but also helping them maintain those positive relationships with family. And we have made some improvements. This is an area that's pretty difficult to move the needle, and that's why those efforts are pretty intense and that we track those closely. One of the most difficult cases is if you have a relative that's out of state. And that's when we have a process that's the Interstate Compact on the Placement of Children. And that process, the length of time that takes, can vary state to state. So DCFS is dependent on the receiving state and how long it takes them to do a home assessment, make sure it's a safe placement, and for us to be able to proceed in placement. The additional difficulty is when you are actively providing reunification services to a parent. You may have a young child, and it might be really important in most cases that you continue those active efforts with supervising visits and family time. We know that based on research, the more family time between the parent and the child in foster care, the more that we can maintain those connections, the greater likelihood of reunification and stability in that reunification. So those are some really difficult decisions if we have appropriate safe relatives out of state that we're exploring, and we have that real important need to maintain that relationship between the child in foster care and their parents. So not easy decisions, but we do always look to assessing what's in the best interest of the child and making those decisions. And I think that concludes my summary. Are there any questions?
Senator Johnson.
Yeah, I was curious. So in the case of a newborn or infant, when does that kinship process start? Because you mentioned removal, right? But yeah, so when does that process of kinship identification start? Is it when parental rights are taken away, or does it start right as soon as there's a placement?
Yeah, that search for kinship really starts day one from removal. And so there are sometimes in cases complications. We may have parents who might be embarrassed about foster care involvement and may be reluctant to